Hello, my name is Charlotte Ewing, and today I'm going to be presenting my family assessment with the Curry family using the Fredman Family Assessment Model and the Fredman Long Form. A little bit about the Curry family. They live in Gardere, Baton Rouge. They are a nuclear family with mom being born in Mandeville, raised in New Orleans, and dad was born and raised in New Orleans. Their firstborn was born in Boston, and secondborn born in Baton Rouge. Mom's side is Hispanic, with dad being from Honduras and mom being from Cuba, whereas dad's side is white, parents born in Louisiana but have Italian heritage. The family's primary language is English, but mom and firstborn can speak some Spanish, and their culture is mainly influenced by their Hispanic side pertaining to food, music, and lifestyle. Both parents were raised Catholic but currently have no religious affiliation, do not attend church, and do not perform practices at home, but crosses and angel pictures were seen throughout their house. Dad's side is devout Catholics. His parents are devout Catholics, and they are an upper middle class. Nate, the husband, is the breadwinner. He is a surgeon, and mom works from home, and they said their income is adequate for their needs. They do own their home. It's a 2-story brick and stucco exterior. It has full heating, cooling, water supply. It's a 4-bedroom home with each room having a bed, rug, dresser, and light source, along with age-appropriate decor. The exterior is uncracked concrete driveway, trimmed landscaping, a gated backyard with a playhouse and swing, and installed Christmas lights. For safety interventions, their medications are stored in a high cabinet. There are no guns in the house. All outlets are protected with plug protectors. They have secured rugs and carbon monoxide detectors along with smoke alarms. They have 2 fire blankets and Viv, which is similar to a Ring camera, along with exterior cameras. The neighborhood, the homes are in similar condition, newer homes in a more suburban, rural area of Baton Rouge. The demographics are upper class and upper middle class, predominantly white, and all the facilities they need are within a 15 to 20-minute drive, such as school, work, groceries, and doctor's offices. And they've lived in their neighborhood for 2 years. They reported that Baton Rouge crime is very high, but in their specific area, their gated neighborhood, the crime is very low. Family composition table. Nate is a father and husband, 36 years old, and is an orthopedic surgeon. Sadie is the mother and wife, 35 years old, and is a content creator. She was a nurse. Blake is their 3.5-year-old daughter in preschool 3, and Brady is their 9-month-old daughter. I use the structural functional family theory to view the family as a system where each family member has a role that supports and functions the family. Sadie is the primary caregiver, whereas Nate is the primary financial supporter. They also use external resources such as nannies, a housekeeper, a therapist, and Blake's preschool to help meet the children's developmental and emotional needs. This framework highlights family strengths and guides strategies to promote healthy child growth and cohesion. Here is the genogram with the immediate family and their parents. History about Nate and Sadie. They met in high school, started dating in college at LSU, and got married in 2018. They moved to Boston for 5 years for Nate's medical residency, where they had Blake, and then moved to New York for a year for additional medical training, and moved back to Baton Rouge to work for the LSU baseball team and had their daughter Brady. Nate's side, both of his parents were born in New Orleans and went to school for chemical engineering at LSU, and they had 3 boys. Sadie's parents, her mom, Sophia, is from Cuba, came over as a baby, did not finish high school, and sold cars her whole career life. And her dad, Paul, is from Honduras, came over when he was 12, not knowing English, and served as a Marine. Nate's family is still in great relationship with him, and they help watch the kids at least once a week, whereas Sadie is no longer in contact with her dad, but is in contact with her mom. This is the eco map. The family maintains strong reciprocal relationships with many members of their community, including Blake's teacher that she sees daily, the mom group Sadie participates in weekly, and Nate and Sadie's workplaces daily. Key reciprocal connections are with Brady and Blake's aunt and uncle on Nate's side, and Nate's parents that help as needed. These relationships indicate that the family receives external support and guidance from friends and extended family. One-way support relationships include the nannies that come daily, Brady and Blake's pediatrician that they see as needed, and Sadie's therapist that she sees as needed, along with their housekeeper that helps weekly. These connections provide support to the family without receiving support in return. Lastly, tense relationships exist with Sadie's parents and the church. Sadie's relationship with her parents is difficult and lacks communication with her father, while her experience with the church has been complicated by past trauma. These relationships contribute stress to the family rather than relief. The developmental level of the family, according to Duvall's theory, places them in the preschool children age, but they are able to adjust to different parenting styles since they do have a 9-month-old. I use the Duvall's family life cycle theory to guide my assessment by looking at the developmental stages of the family with 2 young children, a toddler and an infant, placing them in the families with young children stage, highlighting the challenges that the parents face, like balancing responsibilities, career demands, and maintaining a marital relationship. Understanding this stage helped me to focus on how the parents manage their work-life balance and how that impacts the child's overall growth and family dynamic. The Duvall's theory is a constant movement and changing, which relates to the 9-month-old needing parental attention on feeding, sleep schedules, and early development, whereas the 3.5-year-old is now focusing on social development, fostering independence, learning routines, and mini naps. Parents are still fairly new to their parenting roles, but have been married for 7 years, and they're fulfilling their roles well. Sadie and Nate are both functional senders and receivers. They ask each other if they need assistance with their children, and they communicate to their children clearly, asking Blake if help is needed. Their communication is also direct and consistent. They explain rules to Blake, such as bedtime, eating dinner, dessert, and screen time, and they use an appropriate tone when speaking, no yelling, shouting, or cussing at each other. They actively listen to each other and greet each other when they come home from work. Sadie will ask Blake if she's ever feeling okay or overwhelmed, and they're very encouraging of Blake in her tumbling ballet and her behavior. Blake is somewhat of a dysfunctional sender and receiver. She still tells her parents no after being told something like to go take a bath or eat dinner, and she makes very generalized statements and is emotional when speaking. Overall, the family's power base is egalitarian, and they share joint decisions and power relating to parenting and household functioning. The mom, Sadie, is the resource and expert power. She works from home and spends time managing the children's day-to-day routine, whereas Nate is the referent power and is a role model to his children and is always busy working in the clinic. Blake is a reward power. She will show positive behavior for desired outcomes, such as a treat after dinner or TV time, and Brady is too young to show a power base at this age. Formal and informal roles. Sadie is the housekeeper. She's therapeutic. She helps with childcare and is an encourager. She praises and makes Nate and Blake's ideas feel important. Nate is the provider. He's also therapeutic and a martyr and a pioneer. He sacrifices his time and really everything to provide the best life for his wife and kids, and he has moved his family into unknown territory such as Boston, New York, and Baton Rouge. Blake is a recognition seeker. She looks for attention and acknowledgement and looks to gain approval. She also needs this to shape how she communicates and engages with others in the household. And again, Brady is too young to demonstrate a role structure. Overall, both parents carry many roles, which can lead to caregiver role strain. Family values include productivity, work ethic, equality, and quality of life and health maintenance, and they really value a strong family unit. Here I have cited Nate's definition of health. He believes it's not only physical but mental, such as kissing his daughter goodnight, being around people he loves, and managing stress. And if any of these hinder, it's not just affecting physical illness, but mental illness. For health advice, Nate uses scientific journals or advice from other doctors in the community. They believe their health is well now. Nate struggles with sleep, and Brady has a recently diagnosed allergy to peanut butter. They believe health is important by getting adequate rest, visiting doctors regularly, and they believe that they have control over their health. At the time, they have no dietary practices other than making sure that Blake and Brady are healthy and getting adequate nutrition. For sleep, Blake gets about 10 hours of sleep. Brady and Sadie wake up once a night for feeding, and Nate struggles with sleep, as mentioned, getting about 4 to 5 hours a night. Sleep is not met by Nate, but everyone else meets adequate sleep. Physical activity and self-care. The family does not participate in any recreational activities besides Blake being in ballet, and they are not pleased with that. They do want to be more involved in activities. For self-care, Sadie will get massages and nails done sometimes, but usually feels too tired and burnt out to do anything. For preventative measures, they are all up to date on vaccinations. They visit the doctor for annual physical exams and checkups. And Nate is the healthcare leader within their household, having a background in healthcare. For dental health, they visit the dentist every 6 months. They brush their teeth twice a day. And they feel that health services they receive are adequate, covered by insurance, and they do not have to travel far, no more than 15 to 20 minutes. The family does not have any short-term stressors at the time, but long-term they do deal with relationship with Sadie's parents, raising young children, and Nate's profession. Internal coping includes communication within their immediate family and family time in the afternoons. External coping includes Sadie attending therapy and being on medication. They do not have any dysfunctional coping strategies. The actual NANDA diagnosis is ineffective family coping related to prolonged family stressors, raising young children, strained relationships with parents, and demanding work responsibilities, and inconsistent coping strategies, as evidenced by reports of ongoing long-term stressors, reliance on external coping, therapy, and medication, strained extended family relationship, preschool child with dysfunctional patterns, and need for multiple support systems, such as nannies, therapists, and mom's group. Goal: family will demonstrate improved coping skills within 4 weeks, and interventions: refer the family to the Parenting Center at Baton Rouge General for evidence-based parent-child communication classes. Refer the family to Breck Highlands Road Community Family Programs to broaden healthy family and community support systems. And refer the family to Talkspace, an online therapy platform that offers family therapy to accommodate to busy schedules and help improve family communication. Outcomes: the family will participate in at least one family service or self-care activity once a week within 4 weeks, and the family will demonstrate improved communication by preschool child responding appropriately to at least 5 verbal prompts by next visit. For Nanda, risk for caregiver role strain related to Sadie's increased caregiving demands of 2 young children and multiple family and work-related responsibilities. Goal: primary caregiver Sadie will maintain emotional and physical well-being while effectively managing childcare and household responsibilities within 4 weeks. Interventions include encouraging Sadie to utilize childcare at the Women's Fitness Club playroom, allowing her to engage in exercise or recreational activities, referring Sadie to fresher, healthy prepared meals to provide convenient, nutritious ready-made meals, and encouraging Sadie to utilize the East Baton Rouge Parish Library's free family program and children's storytime sessions to allow for brief periods of rest. Outcomes: caregiver Sadie will utilize at least one recommended service weekly within 4 weeks, and caregiver Sadie will demonstrate a minimum of 20% improvement on the parental stress scale within the next visit. Here are my references. and thank you very much for watching.